Good afternoon once again.
Good afternoon.
My name is Mary Wambui Mathenge. Mary Wambui Mathenge.
Thank you so much.
And I'm seeing the afternoon has been set aside for East Africa. My colleague from Uganda has just presented, and also from Kenya. I work for Amref Health Africa in Kenya. Amref is an international non-governmental organization, and the only one that has its headquarters in Africa. The main offices are in Nairobi, Kenya. So I'm here to present on our experiences working in the public health emergency space. And just to proceed, I need to mention that Africa has really experienced a lot of emergencies, public health of emergency concern in the last years. We've had 700 public health emergencies. We've also had 1.5 billion people affected. And out of these, a quarter of the population is in Africa. You realize that this has creates a heavy burden and pressure for the healthcare workers who are already burdened by the infectious diseases and non-communicable diseases that are already affecting the region. So when we experience further emergencies, it burdens them even more. Now, with more than 2 billion, approximately a quarter of the global population impacted by public health emergencies, it's clear that we need to start having interventions support our healthcare workers who are already struggling with resources, shortages with resources, working in a not very comfortable environment, and also in regard to the fact that most of them are few, so they are not enough for the already limited facilities that we have in those communities. Now, Kenya in East Africa has had a fair share of its public health emergencies. We are currently looking at mpox. We've also had cholera. And then our neighbors had Ebola. So it means then we have to be our top notch when it comes to surveillance. So given the increasing number and frequency and scale of public health emergencies, then it's important that we have a structured mental health interventions to support our healthcare workers. Now, last year, we had rains that really disrupted our normal living. It disrupted by, we had the people dying. We also had a whole village being carried away when we had floods, and we lost a good number of people. This was the first time we were facing and experiencing this kind of disruption in Kenya. Not forgetting in the same period, we had cholera and we also had mpox outbreak in Kenya. So that therefore meant our healthcare workers were very overwhelmed by the outcome of this public health emergency. The rains happened between March, April, and May, and they left a trail of destruction along the way. Now, it was on this background that we felt it's important for us to start psychosocial support. You realize that in most times when we have emergencies or when we have anything happening, accidents, we rarely forget to offer psychosocial support to the healthcare workers, and our focus is usually on the victims. So we forget to protect the people protecting us, and that's why my title is Protecting the Protectors. So for the first time in Kenya, we had psychosocial support for the healthcare workers, frontline healthcare workers, meaning the people that were rescuing the first rapid responders, the rescuers, the community health promoters, the drivers of the ambulances, all of them that were involved. We had a psychosocial support session for them. And we had our focus on the most affected county in Kenya during the floods. So apart from psychosocial support, we also had group counseling, and this was meant to identify the different kind of traumas in this group that we were supporting, because the healthcare workers were affected differently depending on the type of rescue that they were involved in. So it was important for us to identify and see what kind of support we can offer to the healthcare worker. So following our support, we had 24 healthcare workers identified for individual psychosocial support. And we also organized one-on-one counseling sessions for these healthcare workers. And they were very happy because this was the first experience, and they were very excited to participate and work with us in this journey. And we also organized for workload reduction for these healthcare workers. And some of them were also sent on leave. So in conclusion, the outbreaks are going to be there with us, and we cannot just sit and watch as we overburden the healthcare workers that are directly engaged in offering services to those affected. Like I've mentioned, we now have mpox in Kenya. The short trains have already started, and that means we'll probably have an outbreak of cholera. In fact, it's already there in a few counties. And that means that we have to create sustainable healthcare responses to ensure that our healthcare workers are physically, socially, and mentally fit to provide services to our population. So, and then apart from that, we have to ensure that this support is within the healthcare system, and we have to be proactive about it and not only wait when we have outbreaks happening. So our recommendation, just as I mentioned earlier, this is the first time we've had a psychosocial support or counseling for our protectors, the healthcare workers. So we need to do research and studies on how the public health emergencies affect the healthcare workers, looking at their mental health. Then we need to have mental health assessments. This should not be a one-off thing. This needs to be regular. Finally, there's a gallery showing the sessions that we had, the psychosocial sessions, the group counseling sessions that we had with the frontline healthcare workers in Kenya. Thank you so much.